Osteoarthritis is an inflammatory type condition, and there is good evidence now to suggest an anti-inflammatory diet can go a long way to help improve your symptoms. So in today's video, I'm going to take you through 6 types of food that you could consider incorporating into your diet to try and improve some of those unwanted symptoms. When you look online at an anti-inflammatory diet, it's often mentioned in conjunction with a Mediterranean type diet. So I need you to close your eyes and imagine your last holiday to Spain or Italy or Portugal or Greece or any other place in the Med for that matter, and think about how your diet changes when you go to those sorts of countries compared to what it is at home. Now, one of the main differences is the amount of fish that they eat in the Mediterranean. And we're not talking fish and chips, we're talking fresh, oily fish, which is really good for joint health. Now, one of the reasons that fish is so good is because it's high in omega-3 fatty acids. And these good fatty acids are said to help reduce inflammation. Now, the way they work is they seem to have an effect on C-reactive protein and interleukin-6. Both of these things are markers for inflammation. Studies have been done on people that have high contents of omega-3 in their diet, and they've seen lower levels of this CRP and interleukin-6 in their blood, which are both associated with lower levels of inflammation, which is obviously really good news for joint health. Now, it's recommended that you try and incorporate around 110 grams of oily fish into your diet around twice a week, and that's approximately a portion of salmon, although some osteoarthritis experts do suggest having slightly more than that. Now, oily fish would include things like salmon, as we've mentioned, but herrings, mackerel, sardines, anchovies, cod, tuna, and if you're feeling really posh, scallops as well. Next up, number 2 is fruit and vegetables. Now, we all know that fruit and veg is healthy, but why is it a good idea specifically for arthritis? There's a few reasons. One reason is they are jam-packed full of antioxidants. Now, antioxidants help to neutralize free radicals, and free radicals are unstable molecules within our system that are good at damaging cells, and they're closely associated with a lot of chronic conditions like heart issues, diabetes, high cholesterol and high blood pressure, as well as inflammatory issues as well. Antioxidants help to reduce that happening and decrease the inflammation within our system. Citrus fruit is also high in vitamin C, and vitamin C is associated with helping to build and repair collagen and connective tissue like tendons and ligaments and muscle. And vitamin K, which you can find high levels of in leafy green vegetables, is associated with blood clotting, wound healing, and it's also associated with bone health as well. So how much should we be incorporating into our diet on a daily basis? Now, we need to be aiming for at least 5 portions of fruit and veg every single day. Now, a portion is going to be a banana or an orange, or for most vegetables, it's going to be a cupful. For leafy green vegetables that are a bit airy and take up a bit more space, that's going to be 2 cups of leafy greens equals 1 portion. Now, the Arthritis Foundation do suggest that we should be aiming for at least 9 portions if we do have osteoarthritis. In terms of where we can find these things, vitamin K, leafy greens, we're thinking spinach, broccoli and kale. For vitamin C, we're thinking fruits like lemon, lime, oranges and grapefruits. And in terms of fruit and veg that's high in antioxidants, it's supposed to be the ones that are most colourful. Number 3 is olive oil. Now, it might sound a bit strange, but olive oil actually has a lot of really helpful biochemicals that could facilitate improvement in our osteoarthritis symptoms. One of those is called oleocanthal. Now, studies have been done on this biochemical, and it actually works in the same way that we try and use and target anti-inflammatory medications like ibuprofen and naproxen. So it's said to have really good anti-inflammatory properties. It's also been found that it's quite helpful for pain sensitivity too. It's also high in polyphenols, which are a micronutrient found in plants. Now, the reason that polyphenols can be really helpful for arthritis is because they are high in antioxidants, and we've already discuss the benefits of those. Now, how much should we be trying to incorporate into our diet daily? Now, it's recommended 2 to 3 tablespoons per day should be about adequate. Important thing to note is that if you're having a look at what olive oils are available or which ones you're going to buy, extra virgin olive oil tends to have had less refining than some other olive oils that may be available, and subsequently tends to have more nutritional value. Number 4 are beans. Now, beans have loads of really good nutrients for osteoarthritis. One of those things is fiber. They're really high in fiber. Now, fiber is associated with good gut health and digestion. It helps to neutralize the bacteria within our digestive tract, and it helps our food to be absorbed effectively. It also helps to fight against things like type 2 diabetes and coronary heart disease. Now, there have been a couple of studies done on arthritis specifically, and it has been suggested that people that have diets high in fiber tend to get less knee arthritis symptoms than those that have low contents of fiber in their diet. Beans are also high in phytonutrients, which can also be found in things like fruit and veg, nuts and spices, teas and whole grains. Once again, they're high in anti-inflammatory properties and antioxidant properties, and have been found to decrease levels of CRP, that blood marker, that inflammatory marker that we were talking about earlier. It's been said that they can also be good for eye health and immune health, and help to fight cancer and coronary heart disease. So how much should we be eating every week? We should be aiming for around 1 cup twice a week. Now, you can find these sources of nutrients in things like red beans, kidney beans, pinto beans, soybeans, navy beans, and peas too. The 5th food that would be a good idea to try and get into your diet would be some nuts and seeds. Now, nuts and seeds are brilliant for 2 reasons. They're high in monounsaturated fats, and they're high in arginine. Now, arginine is supposed to be good for relaxing our blood vessels, improving our circulation, and also lowering that CRP, that inflammatory marker that we want to try and keep nice and low. Monounsaturated fats are useful to facilitate how we store fat within our system straight after a meal. They've also been found to decrease our lipid profile, which is the blood test we do to have a look at the amount of fat within our blood. And lastly, they're also really good at decreasing that unwanted inflammation. So how much? Well, we're aiming for 40 grams daily, and that equates to about 1.5 handfuls, but there's lots of ways you can get them in during the day. You can chuck them in your bowl of fruit and natural yogurt first thing in the morning. They're a really healthy snack that you could have with some dried fruit during the day instead of that packet of crisps or chocolate, and they're great in curries and salads too. And you can eat any nuts. We can aim for almonds, pistachios, walnuts, cashew nuts and peanuts are all really good sources of nutrients. Last but not least, number 6 is whole grains. Now, they contain a lot of the good stuff that we've already spoken about with our other food types. They're high in fiber, they're high in protein, they have antioxidant properties, and they also have lots of vitamins and minerals like magnesium, zinc and iron. Now, one thing that I didn't mention earlier about fiber that it's also really good at is it's good at making you feel full afterwards, which is really important. So if we're trying to lose weight and we're trying to cut down on portion sizes, getting some fiber in can be really helpful. And it also means that you may not need to snack so much between meals because you're not going to be feeling so hungry. We're aiming for 170 grams daily, of which 85 should be whole grains. That basically means the kernel on the grain has been maintained when the food is being produced, and it should give a bit more nutritional value. In terms of what we're looking for, we're thinking about foods like barley, oats and corn. Millet, rye and quinoa can be another good type. A really healthy snack could be popcorn, and think about getting some brown rice into your diet and some whole wheat bread or pasta. Please do let me know below the video if you've tried an anti-inflammatory diet and the effect it had on your osteoarthritis symptoms. If you have enjoyed it, like it to show your appreciation, and if you're new around here, subscribe so you get notified every time I release new osteoarthritis help, which I do every single week. It also means more people will see the video that you found helpful. Whilst you're doing that, I'll see you in the next one.